Hi, I'm Dr. Claudia Kim, cosmetic surgeon here at New Look New Life. Today I'm going to talk to you guys about fillers, so general informational video about what fillers are and the different types of fillers, and also about the way that we use fillers to augment certain parts of the face or even the body. So you're using a product to volumize certain parts of the face and body, right? So fillers are filling in certain things. So depending on what you want to address and what you want to improve, there are different types of fillers. The most common types of fillers are hyaluronic acid fillers or HA fillers. So those are the brands that most people have heard before, like Restylane, Juvederm, things like that. And so it is commonly used for, let's say, for lip augmentation, to make the lips a little bit fuller, to give yourself a little cheek definition, or to fill in the shadows of the face. As we age, we go through very typical changes and characteristics, which is pretty much universal throughout every single person. And that change is usually the loss of volume or the loss of collagen and elasticity. Every year that we get older, we do lose that bounce back or the elasticity of the skin and the tightness of the skin and the volume of the skin. The typical characteristics that we see is a loss of volume to the mid-face area and the lower face area. So if you notice the pictures from when you were younger, your cheeks were much fuller and it provided more support to the middle of your face. As we lose collagen and elasticity, that supportive system starts to kind of slide down. So the common areas of the face that we use filler is to put volume back into the cheek area, to fill in the shadows of the nasolabial folds and the marionette lines, and also to soften up the jowl here on the lower part of your face. So we can use fillers to address the hollowness in the under eyes. Perhaps you're looking a little bit more tired and you need to have a little bit more volume in the lower lid. Or let's say your cheeks are starting to become a little bit less pronounced or defined. You can use fillers to give yourself a nice contour of the mid-face and also to create a little softening of the nasolabial folds. Because the culprit is the sagging fat pad in the cheek area, when you give the lift of the cheek, it also softens the nasolabial folds. A lot of the times you do have to do filler directly into the folds themselves, but you do have to treat this area as a unit. And finally, we do use filler for the jawline. Now, since the fillers is filling in shadows, it's not lifting or it's not really tightening or removing anything. It creates the illusion of contour by the play on light. And what I mean by that is that the jowl here is the area that kind of pooches down. We can use fillers to kind of create the positive space behind the pooch and in front of the pooch, to create the illusion of a straight line or to create a softening of shadows. Now, depending on the subtype of the filler, the duration can differ. And what I mean by that is that there are specific types of filler that are within the umbrella of fillers that determine the longevity. I won't go into too much detail in regards to that, but there are some types of fillers that are meant to last a little bit longer in certain areas, and it's meant for certain parts of the face. For example, for the areas that we want to build structure or create structure, most commonly it will be the cheekbone area or the jawline or the chin. We need a filler that's a little bit firmer or stiffer because it is actually injected deeper to give that lift and that support. Now, for areas that are much thinner, such as the under eyes, the nasolabial folds, or very easy to understand in the lip area, you don't want a filler that is stiff or firm, or it can be potentially visible, or it can be very hard. You can feel it when you kiss someone. So make sure that your provider knows which appropriate filler to use for which part of the face that you want to correct. Another common question that I get asked is, how long do fillers last? So kind of a rough estimation is that if you put hyaluronic acid fillers into an area that moves a lot, so let's say the lips or the lines around the mouth, you're constantly eating, talking, chewing, so it has an area where it's constantly moving. Those tend to last the shortest in duration. If you put it into the mid-face, and mid-face I usually refer to as kind of this area here, it has a little bit of movement but not as much as the lower part of the face. Those fillers can last about 6 to 9 months, and these are hyaluronic acid fillers. And within the subtype, there are certain fillers that are meant for the cheeks that last a little bit longer. And then finally, if you put it into an area, let's say for like the under eyes, because it's really not in a place that moves much, those fillers tend to last the longest. In some individuals, I've seen remnant filler in the under eyes even 4 or 5 years later. So if it is something that you are considering a surgical intervention for, just make sure you do do tell your surgeon to dissolve out any pre-existing filler that can be distorting that lower lid region for potential planning of surgery. HA fillers are, again, what we commonly use for the majority of people, and especially if it is your first kind of experience or first experimentation with fillers, I would recommend doing hyaluronic acid fillers to begin with, because there is an enzyme to dissolve it, just in case you don't like the effects of it. Another type of filler that we commonly use is calcium-based fillers such as Radiesse. The Radiesse does not actually have a dissolvent, and it does get metabolized with time, but it does take longer in comparison to hyaluronic acid. So do be careful when you are using Radiesse, just because of its limitations in comparison to hyaluronic acid with not having a dissolvent. Radiesse is really good because it is a stiffer firmer, so it's really good for the cheek area, the jawline area, the chin area. Because of this biostimulant quality, we can use a diluted form of Radiesse to stimulate collagen in non-face areas. You can use Radiesse to address the horizontal lines on the neck, which is commonly seen with people being on their computer, on their phones, or you can actually use it to stimulate collagen or plump up the areas that you see the cellulite dimples or the crepey skin on the thighs and the butt. So there are different uses for the Radiesse, and not just the volumizing component, but also for collagen stimulation. Another type of filler that we use as a biostimulant is Sculptra. So Sculptra is a molecule called a PLLA, which is absorbed by your body to actually start building your own body's collagen. It doesn't work right away. The initial improvement or the volume increase that you see after the injection is actually caused by the water and the local anesthetic that the Sculptra is dissolved in. So the Sculptra itself has to be prepared in advance because it's actually in a powdered form. So your provider may ask you to confirm their appointment, and they need to mix the product in advance. So the initial plumping that you see from the water goes away in about 2 days, and it goes right back to baseline. But the Sculptra starts to work, and you actually see the peak collagen or the peak collagen production after about 4 to 5 weeks. So usually providers will have you do a treatment regimen where they start you off with, let's say, 2 to 3 vials, and then reassess you after the 4 to 5 weeks to determine how much more Sculptra that you need and to evaluate the effects of it. The other ways that we use Sculptra, not only for the face, but also for the breast, also for the butt area, to actually give volumization for, let's say, someone who doesn't really have that much fat stores, to do fat grafting to the butt or fat grafting to the breast. You can use Sculptra to volumize or create volume to those areas. However, it does take a significant amount of product to potentially get to a sizable increase in volume or size. For example, depending on how much volume you're trying to achieve for the buttocks, you're talking about 10 vials or potentially up to 10 to 12 vials per session for the total butt, up to 3 to 4 sessions depending on how large you want to get. So it's definitely not cheap. So if it is your only option in terms of volumizing, it can get quite expensive. Another question that I get commonly asked is, how much filler will I need? Just to give you a perspective of how much filler is in a syringe, a standard syringe has 1 ml or 1 cc's. There are 5 mLs in a teaspoon. So if any of you guys have baked, a teaspoon is actually not a significant amount. So if you are imagining using a teaspoonful of product and you're trying to address multiple areas of the face, it really doesn't make that much of a dent. So a lot of the times when people try to minimize the amount of fillers because of their either fear of being overfilled or due to financial reasons, you do have to realize that the more product that you spread in a larger amount, the less effect that you will see. A common thing that I hear from patients who've had fillers before is that, oh, I didn't really see an effect, or I really didn't see a difference. And most commonly it's because they didn't get enough. So again, 4 to 5 syringes for someone may not really make a big difference if you're looking to address the under eyes, the cheeks, the nasolabial folds, and the marionette lines. Obviously, the younger you are, the less volume you will need. And so you may be fine with just doing a few syringes in your early 30s, which you may progressively need a little bit more as we get older. In comparison to someone who is in their 50s, 60s, and 70s, you may need quite a few more syringes to really have an effect or noticeable difference in the facial volume. Now, sometimes you can use fillers to just augment certain things that have nothing to do with aging whatsoever. For example, we can use filler to do a liquid rhinoplasty, which means that you are using filler to create the illusion of certain things about the nose and the contour of the nose. Obviously, it's not equivalent to surgical intervention, but for people who do have minor irregularities on the nose, the filler can be helpful and to create a smoother contour. Another common area that we use filler for is for chin augmentation. So in some individuals, if their chin is a little recessed or is not as pronounced, you can use filler to give yourself a little bit more pronunciation or projection to the chin that gives more balance to the face. Obviously, the more volume that you will need will require more product. In some individuals, fillers might be a good trial before they consider doing a more permanent intervention, such as a chin implant. Or some people might just like having the filler instead of having a permanent implant and may just continue to do fillers instead of an implant. So what to know before actually getting filler? Obviously, because it is being injected by needles, there's always a chance of bruising. So just remember to stop all NSAIDs up to 7 days before any injectable appointment. Now, if you do bruise, obviously all bruising goes away. Usually the bruising will last a few days and you can use makeup to cover up any bruises. Other risks of fillers is infection, migration, and the biggest risk and complication would be what's called vascular occlusion. This means that the filler was actually injected into a blood vessel and it blocks the flow of blood. Now, blood is very, very important because it delivers oxygen, nutrients to the skin. So when there is an occlusion, it means that the filler is blocking the flow of blood, potentially causing death of the skin that the blood vessel feeds. Now, there are certain parts of the face that are much more riskier for fillers, such as fillers in the area between your eyes, filler in your nose, in your nasolabial folds, and your lower eyelids, and around the chin area. So pretty much everywhere that we talked about. Those areas tend to be the most risky because they can be the only blood vessel that is feeding that part of the skin. So imagine injecting filler into an area that is providing blood to the skin or perfusing the eyeball, right? So if that flow of blood is blocked, then that skin can potentially die, and or if the flow to the eye is compromised, it can cause blindness. So very, very serious stuff. So what to look out for? Now, obviously after the injection, you may have a little bit of bruising or bleeding. That is normal. And usually the bruising is minimal or just kind of localized to the area where the needle went in. However, if you do see that there is like a spider web or almost like a patch of darkness, right, duskiness, or in the earlier stages, if it's kind of blanched, right? So when you come in from somewhere cold, you know how your fingers are kind of white and blanched? Usually if you're pushing on that white area, it should kind of pink up. But if it's white and you're pushing the area and it doesn't pink up, then there's a high chance that you might have a vascular occlusion. And this can potentially happen within a couple of hours of the filler session. Other things to look out for, but it may not present early on, is pain. A little bit of soreness here, again, from the needle is very common, but let's say there is more discomfort in a wider area of the face. It's time for you to call your provider immediately because there is a chance of vascular occlusion and you have to inject the dissolvent into that area to potentially dissolve out and flush out all of the filler that is occluding a blood vessel. Okay, other serious symptoms to look out for is, let's say you did under eye filler or any filler around this area and you're starting to get double vision or blurry vision, or if there's some kind of spots, some kind of visual abnormality, visual disturbance that you see, call your provider right away. So what happens if you don't address vascular occlusion immediately? So the stages of change that we see in vascular occlusion in the earlier stages is that blanching, the white, and then it can turn dusky. So it kind of looks purple, almost like a bruise. And then if the blood flow has been stopped for a longer period of time, then the skin will start to die. It goes from blisters to eventually looking like a scab or just black skin. When it reaches the stage of looking like a scab or black skin, it means that the skin has already died. So there's really not much you can do to salvage that. Your provider may have to consider sending you to hyperbaric oxygen treatments. So these high oxygen treatments can help to force oxygen into the skin to actually try to perfuse it and to try to prevent any further damage. Or they may have to clean up some of that dead skin and allow that new skin to grow. Obviously, depending on the extent of damage, there can be a significant amount of scarring, and it can take a lot of time for your skin to heal, potentially up to several months. Because this is a very significant complication of filler injections, make sure you do find a provider that knows what they're doing, that knows your anatomy, and knows exactly what to do if such complication arises. I hope you learned a lot about fillers. There is a lot to say, there's a lot to learn. If you like videos like this, follow me for other educational videos. Thank you.